So Dr. Smith, after bariatric surgery, why is it important for a patient to really monitor and pay attention to what drugs they're taking and how they're taking them?
So there are numerous medications that we ask you to take after bariatric surgery that are largely vitamins. And some of these can interact with each other. For example, we're going to put you on a multivitamin that contains iron. Our multivitamin that contains iron happens to be a prenatal vitamin. So even if you're a man, you're getting prenatal vitamin. But it's going to be good for you. It's going to contain iron. One of the most common malnutrition problems that we have after bariatric surgery is actually vitamin D deficiency and also iron deficiency. These are very common no matter which bariatric surgery you have. So we also put patients on calcium with vitamin D. Now, interestingly, there's a competition where your body absorbs iron and calcium. So you can't take those two medications at the same time because the calcium will always win and you won't get the iron. So we need you to separate your calcium and vitamin D from your multivitamin with iron by at least 2 hours. So that's one important strategy for taking your medications after surgery. Another medication that we're going to give you after surgery that we ask you to take for 3 months is omeprazole. This is a proton pump inhibitor. And before surgery, if you had reflux, you might have been taking this medication as a whole capsule. It comes as a capsule and inside it has little granules. But after surgery, we need you to take that capsule and open it. Sprinkle out all the granules onto a teaspoon of something that's sugar-free, like sugar-free Jell-O or sugar-free pudding, or you can sprinkle it onto a teaspoon of Greek yogurt or applesauce. Take that medication 30 minutes before you eat. The timing is important because the job of this medication is to touch the lining of your stomach and turn off the acid-producing cells in your stomach. And then when you eat, then those acid-producing cells won't turn on, and that will be protective for you as you're recovering from bariatric surgery.
So why is it that prior to bariatric surgery, I could leave it in the capsule, but now I have to take it out?
Because before bariatric surgery, you had a big stomach that had time for that capsule to melt. And now you have a much smaller stomach, and it doesn't have time for the capsule to melt. It'll fly right out into your small intestine, and there it won't do you any good. So that's one medication that you're always going to have to open and sprinkle for your lifetime. So if you're a patient, for example, who had Barrett's esophagus before surgery, you might be staying on your omeprazole or your proton pump inhibitor for life. And so that's a medication that you're going to have to open and sprinkle forever because of this issue. Most medications, you don't have to crush or open or sprinkle or do anything differently once you have bariatric surgery. But this one medication, because of the way it works, you always have to open it and sprinkle it.
Do patients have a similar experience or issue with regard to just simple things like Tylenol or Advil or any of that?
Some patients will report that they have dysphagia after bariatric surgery. That means that they have the sense that when they swallow, things get stuck. They particularly feel it right at their breastbone. And that is usually just because of early postoperative swelling, the very small space that they're trying to get their medications into. And pills can hang up there at the lower esophagus. For this reason, some surgeons will advise their patients to crush their medication or switch to liquid medication early after surgery. Because if medication does get hung up there, it can cause esophagitis. It can even cause ulcers. But personally, I've never seen that happen to any of my patients. So we don't give that advice. We let patients take their whole medications.
Hey folks, connecting with your benefits is our primary mission, and theSITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.